Dengue, the sequel. You've come to the second part of the video and missed the explanations about the virus, the risk factors, and the investigation. But it's okay, you can still watch it after this. Treatment. The specific treatment for dengue fever is not available yet, but there are several general treatments that can be introduced to patients, such as antipyretics to reduce fever and painkillers to treat muscle or joint pain. However, NSAID or non-steroidal anti-inflammatory drugs like ibuprofen and aspirin should be avoided. They thin the blood and can exacerbate the prognosis of disease with hemorrhage risk. For severe dengue, intensive medical care by physicians and nurses can decrease the progression of the disease and the mortality rates from more than 20% to less than 1%. The management of the patient's body fluid volume is critical to severe dengue care. Vaccination against dengue. If you are a resident of or traveling to any tropical area where dengue fever is previously reported, prevent and reduce your risk of acquaintance. Stay in conditioned or well-screened housing, because the mosquitoes that carry dengue viruses are relatively more active from dawn to dusk. Wear protective clothing like a long-sleeved shirt, long pants, socks and shoes. Use mosquito repellents like Permethrin to be applied to your clothing, shoes, camping gear. By eliminating habitats where they lay their eggs once a week and emptying and using containers of standing water, such as planting containers, animal dishes, and flower vases. Keep standing water containers covered between cleanings. Foreign aid. Recently, scientists from Australia and Indonesia are working together to fight the disease. They turn to another creature, a bacteria called Wolbachia. They inject the bacteria into the mosquito's eggs, breed them in the laboratory, and release them into the wild. Then, the spy mosquitoes will eventually mate with the natural, disease-ridden of their kind. Naturally, their babies will also carry the bacteria, but it has the ability to disrupt the reproductive process of the mosquito, while also reducing the lifespan of their offspring, preventing the next generation of mosquitoes from spreading dengue altogether.